Hello and welcome to this presentation about using evidence at the point of care. So this is quite an important topic because I think we will do more and more of this throughout the NHS going forward. There's a lot of development around evidence provision at the point of care and also about how to get the best evidence to people when they need it, where they need it. So this is slightly different from looking for journal articles, for example, or doing a deep literature review. This is about evidence that will help you on the spot, hopefully. And we have quite a lot of resources available through the Knowledge Network. My name is Dr. Tim Zelstra. I am the NHS librarian for Tayside, and this is the website that we call the Knowledge Network, which is a collective of all library and knowledge services across Scotland. You find this website by going to knowledge.scot.nhs.uk. I recommend that you view this video on large screen rather than on a mobile phone, for example, mainly because some of the text that I will be going through you might want to be able to read, and if you do that on a mobile phone you will be staring at the screen for ages not knowing what it is that you're looking at. So do watch this on a large screen. So the Knowledge Network is a collective from across Scotland, and we work together very closely with different parts of the NHS in Scotland. And together we are able to provide you with a lot of resources that might help you, and in this particular case, at the point of care. So on the web page, on the home site, you can find this section here, find the evidence, and you will see that it says guidelines and evidence summaries provide decision support at the point of care. They are a good place to start as they are easy to navigate and search. Alternatively, search for articles and books in the library search. So there's a clear distinction between what is a point of care evidence tool and what is in the literature. I will go through 4 of these tools in particular, well actually 2 because they look very similar, 3 of them. They are provided by the same company, but I hopefully will be able to show you what you can use these tools for. Now it's important to know that even though I've asked you to watch this on the big screen, these tools are often available as an app on your mobile phone as well. And to demonstrate that, I'm just going to click on the little logo which says BMJ Best Practice DynaMed, and that brings us to this page. Now there's a lot of information available here and I suggest you have a good look at all of it. I will have a specific video on this bottom section here because I think that is full of little gems that you might want to use. But today we are looking at BMJ Best Practice, which is produced by the British Medical Association and is a tool that's really well known, really well used as well across the NHS Scotland and the NHS in general. And I will also be discussing these 3 tools which are produced by EBSCO, and they are DynaMed Nursing Reference Center Plus and Rehabilitation Reference Center. And I will look, just to make sure there's a bit of variety, I will look at the Rehabilitation Reference Center as well. But these 3 tools are fairly similar in layout in the way that they work. So the first thing we are going to do is go to BMJ Best Practice. And what we will see here is that this is a very rich tool. So because I am logged in at my home computer through NHS Education for Scotland, I can access this resource for free. But I can also create a free personal account. Now, I'm not going to do that in this instance, but with that account, you can also use the BMJ Best Practice app. So if you want to use the app, which I recommend, it's really useful, really safe to use as well. What you do is you go to the website, you create an account here, and then you go to the app and you use your details to log in, and then you can use this app everywhere you go, provided you have internet. The other thing that I want to talk about just real quick is what is the evidence that you will find here. So this is really aimed at the front line, at the point of care. So for example, you get a patient coming in and they discuss something and you're not quite sure what it is that they are talking about. You've got a bit of a clue, but you want to make sure that you don't give them any tough information. You could look at this tool and find some evidence to go along with that. So how does that work? Well, you can see here that you can search for conditions, symptoms, and so on. So let's just say that a patient comes in and they present with psoriasis. And you're, for example, a new GP, you're still training, and you know what psoriasis is. You've covered the theory of it, but you might want a bit of backup to get better information so you know what you are talking about. And when you search for psoriasis, you will get a lot of different results because sometimes psoriasis seems to present, but it could be something else. It could be eczema, it could be nappy rash, it could be common cutaneous drug reactions. I'm not a medical doctor. I keep saying it. Sometimes I say words like pityriasis lichenoides. I haven't got a clue. But it may well be useful for you to have access to these different sources. And what's really cool about BMJ Best Practice and DynaMed as well is that a team of specialists behind the scenes is making sure that all these links, all these suggestions are working properly. So there's a lot of information professionals, a lot of librarians who are working on this content. So you will see here psoriasis and you can see the summary, history and exam, investigations, differentials, and the treatment algorithm. So let's say that you just want to have a bit of information and you go to the summary. What you can then read is that psoriatic lesions are red, inflamed, silvery white, scaly, etc., 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 and a definition as well. And with the definition, you will find a source. So if you click on that, it will actually give you a reference that is the article that was used to define what psoriasis is. So this gives you security, the knowledge that this definition, this information is based on actual work by clinicians in the field and is properly peer reviewed as well. So you can also then find out about the theory, so epidemiology, the etiology, the case history. You can also talk about how would you go about doing a diagnosis. So you can actually see that there is, I do apologize, these cookies drive me nuts on BMJ. They keep coming back. I'll keep clicking them away. But you can see that there is information that will help you, for example, with the physical examination. What do you need to do? And how do you differentiate from certain things, right? So it's really, really full of good information. And you can also see there's really high quality images. So it is a really valid, valuable resource to help you. And I can't recommend it enough. If you were to talk about how am I going to put a care plan together, for example, for this particular patient, you could look at management and approach. And the aim of treating psoriasis is to decrease the percentage of body surface involved. And that already gives you a bit of an explanation to the patient as well. You can say, look, we're going to try and bring the surface area down. If it goes up despite this treatment, I want you to come back so we can try something different, for example. So this is again really valid, and again you get all your references to particular treatments, to particular findings that people have found in the past. So that's one part of this particular app, and it's only a small part in a way. If you click on specialties, you can also find the broader area that you are involved with. So let's say that you're in neurosurgery and you click on that, you will then find cookies, you will then find lots of information about different diseases and conditions that link to neurosurgery. If you're in an emergency department and you think, oh dear, this could well be neurosurgical, it's an acute cervical spine trauma, what do I do? You can then get a summary here and you get that same information that you got for the psoriasis, but then about this particular symptom or condition. Another really cool tool on here is all the different calculators. You will know if you are in the front line that you use lots of different tools to do assessments and to actually work out what is going on. And you will find that there are over 250, I believe, over 250 evidence-based medical calculators here. And what they call a calculator, it can also just be an assessment tool, but there's a lot of stuff in here. Apache 2 scoring system, the APGAR score, the Canadian head CT rule for minor head injury, the CDC height for age percentile of boys 2 to 20 years. You will see that there's loads of stuff in here. If this list is too overwhelming, you can search for the particular one, or again, you can go to the specialty and you say, I'm an anesthesiast and I need to know about the cardiac risk index for orthopedic surgery, right? So there's lots of stuff there. Another really nice addition to BMJ Best Practice that you also will find in DynaMed is patient leaflets. So you've had a conversation with a patient about the condition that they're suffering from, and you want them to have something that they can actually take home, that they can discuss with their family if they need to, so they have information. And these leaflets are designed to be easy to read. Now, that is still up to your clinical judgment. It's the same with everything in these evidence sources. You need to assess whether the information is appropriate or not, whether it needs changing. But it gives you a really nice starting point. So if we go and look for psoriasis again, what is it? It'll give you a PDF that you can download, or you can just have this website copy paste into an email, whatever you want to do, and it'll tell people what psoriasis is. And this is updated regularly again by professionals that work with BMJ Best Practice that make sure that this is always up to date. So if there's any changes in the way that these diseases are treated, for example, then they will actually update it here as soon as they see there's a need for it. So again, very, very powerful. If you are training and if you like to see videos, they actually have a really wonderful resource of videos that are animated a lot of the time, but these are things that people can use to understand better what they want to do. So a back valve mask ventilation animated demonstration will actually show you how a back valve mask works and what the effect is when you use it. So you can see that it's being pumped, you can see what it looks like, and then there's the subtitles that help you to understand what's going on. So these are again really, really useful resources. If you have a colleague who needs to relearn how to do something because they worked in a different department for a while, or whatever else it may be, have a look at these videos. They're really high quality and really easy to find. Case reports is quite interesting. This is basically reports on rare diseases and unusual presentation. So this is where specialists can gather information on something they've not really encountered before, something that really puzzles them. And if it's really puzzling, they can publish it here as well, and then maybe get feedback from colleagues who might have encountered it before, and hopefully together you can then work on resolving this issue, hopefully preventing it in the future, or at least recognizing it in the future. Then there's the evidence. I find this not the most useful, but that's because I don't particularly like the idea of evidence tables. You can have a look at that. And then finally, there's a drug database links basically to BNF, Micromedex, and BNF for children. The nice thing about all of this is that it's all in that app as well. So if you are walking around with your phone, with your iPad, you can access this if you have the internet. So that's really good to know. So that's BMJ Best Practice, and I'm sure you will agree with me, this is a really powerful tool. That said, DynaMed is equally powerful, it's also a really interesting tool. The big difference, I suppose, between the two is BMJ is really full of content that is British in a way, and DynaMed is a bit more American focused. So do bear that in mind that there is a bit of a difference there, but that doesn't make DynaMed a less valid tool. So the other thing, and it's I just want to say that it's a case of preference, right? So do you prefer DynaMed? Do you prefer BMJ? Try them both. See which one you get on with best. The other things I want to talk about was this Nursing Reference Center Plus and Rehabilitation Reference Center. And in a way, they're very similar tools, but with a different purpose, a different audience, and they will give information in specific contexts related to either rehabilitation or nursing. And if we go to Rehabilitation Center, Reference Center, you will see that this is a bit more outdated maybe, but it's still really powerful and chock full of information. So one of the things that knee replacement. Yeah. So one of the things you can do here is actually look for information regarding treatment plans and having creating treatment plans and care plans going forward. So if you look for knee replacement, there we go. You can see that this will link to resources that are more applicable to our nursing and allied health professionals. So here there's a total knee replacement physical therapy from CINAL. And that's one way that you can see that it's more aimed at nurse and allied health professionals. CINAL is the Cumulative Index for Nursing and Allied Health Literature. So it's more specific for nursing and allied health. And you can see that there are a number of really good resources here that you can instantly access from within this tool. So if you say osteoarthritis knee non-operative management, for example, if that's what the patient is dealing with, then you can click on that and you get an overview that was created, curated by specialists who actually work in this case for the CINAL information systems, and they will update this text as soon as it needs updating. So you can see here it was updated in September 2021. It gives you a really good full-on explanation of what is osteoarthritis, how does it present in the knee, what sort of contraindications are there, what sort of precautions do you need to be aware of, how do you examine it. So if you go to examination, when the symptoms of knee OA osteoarthritis begin, did a traumatic event precipitate symptoms, does history indicate gradually worsening? So these are all questions that you can talk with the patient about, and then you can start thinking about what is it that we can do to treat this. And then you can also, if you scroll down a bit further, find information about assessment and plan of care. So you could use, for example, cryotherapy, thermotherapy, and it will also give you contraindications. And again, just like in BMJ, you will find the references to what people are using for evidence. And as you can see here, it is absolutely chock-a-block with evidence. So really powerful and a very useful tool. Right, so if we go back to the home button here, there's some more stuff in here that you might want to find and use. You can look at a list of diseases and conditions. If you're not quite sure how to spell it, for example, you could use this. So osteoarthritis, I think we looked at. Whoa, next. There's too many diseases in the world. Oral. Oh, we're gonna get there. Osteoarthritis. There we go. Of the thumb, cervical, hand, hip, knee, spinal, etc., etc., etc. So as you can see, it's all there. Like I said at the start, the interface for this is a bit more old-fashioned, not quite as slick as BMJ or even DynaMed, but the content is what matters. You can also find different practice resources here, like clinical reviews. And when you click on that, you can get back to where you were. That was not quite what I expected. Exercise images. Yes, this is what I was looking for. Right, so exercise images are again really useful for your patient communication. So if you, for example, are trying to get a patient to understand what a medicine ball can be used for, how you use it, you can get general tips here. And what they have done very cleverly is taken images from particular journals or articles or books, and they use those to show this material. Now this one unfortunately isn't particularly relevant in my opinion. Let's go and see if we can find a nice image of something. Trunk. Core strength. Yes, the ankle chop, one of my favorites. And you can see here that you get an image that actually shows you how to do this particular exercise. So you can also use this in this case to fill out for the patient. You can print this, say, hold a 3-pound ball outside of ankle, etc., etc. Repeat 5 times, rest seconds, do sets. So this is really useful as well. Again, slightly less intuitive for navigation, but once you find your way around it, it's full of good information. So these tools are really, really valuable, and I really encourage you to use them. My name is Dr. Tim Zelstra. I am the NHS librarian for Tayside, and this was all about evidence sources at the point of care. Thank you for watching. Bye bye.